Does the type of vasectomy determine reversal results? Hi, this is Dr. David Wilson with ReversalClinic.com. We are the largest provider of vasectomy reversal in the country because we are helping families grow. A common question for patients and families before reversal is, well, can my vasectomy be reversed? The doctor did this, and that, and maybe he said it wasn't repairable. Is there a type of repair that we shouldn't try to fix? In this video, you may hear some information that you won't get anywhere else. I'll be describing the many different types of vasectomy and the impact that it may or may not have on the actual outcome of your reversal. As you know, vasectomy blocks the flow of the vasal fluid. Vasectomy blocks the flow of the sperm from the testicle being transported to the common channel urethra. The actual blockage at the vasectomy site can be performed in many different ways, many different techniques and methods. Suture is a common method where there is material tied around the vas to prevent flow. Cautery or electrocautery current is commonly also used to seal off the vasal lumen or to block the vas down. And not uncommonly, metal clips can be used. These are very, very small clips that are often embedded within the scar of the vasectomy site. In addition, not uncommonly, a portion of the vas is actually removed, a section is removed. A piece half an inch or an inch can be removed, not uncommonly, in these vasectomy procedures. Less common techniques would include the no scalpel technique. It basically uses a very small incision to gain access to the scrotal sac. Also, open-ended vasectomy was a modification where the vas end toward the testicle was left open in order of hopes of improving results. A laser vasectomy is simply using another method for cutting during the procedure. Fascial interposition was used because there are probably about 0.5% of cases in which the vasectomy itself actually fails because the channel is healed or rejoined. And these vasal interposition techniques bring tissue over the end of the vas, or the doctor will say he tucked the vas under to try to prevent failure of the vasectomy. Not uncommonly seen. Vas crimping has been done the last few years, the so-called vas clip or pro-vas. These aren't done commonly now. It was found that even with the so-called crimping devices, a surgical repair was necessary. So these vas crimps do not improve results of reversal. In fact, none of these techniques has a known scientific predictable outcome for results or success of the vasectomy reversal. The type of vasectomy, the method or form of vasectomy has not been shown in any scientific studies to impact the actual outcome. The fact is that the repair we've done for 12 years for thousands of patients is the same repair no matter what type of vasectomy is done. Here's a diagram of the vas deferens, the tube coming up from the testicle, with a depiction of a scar. Now this scar is schematic. The scar could appear much different than this. It could have some gap between the two ends. It could be larger or more irregular. But basically the scar is the point at which the doctor destroyed the vas. It's basically a mutilation of the vas. And there's a scar that forms whatever technique is used. And this scar blocks the flow. So what is done is there's a division of the vas into the healthy tissue. The ends of the vas that are well perfused have good blood supply, and the inner portion of the vas is very distensible and very healthy. Those cut ends are then brought back together to form the repair. Now these portions of the vas are actually lifted up off of the underlying cord in order to gain laxity of the vas deferens to get a repair that has no tension. Tension is an enemy of good blood supply and healing. So this vas deferens is brought up off the cord in order to redirect the lie of the vas in the scrotal sac in order to bring this back together without tension. And this is a depiction of microsutures being used to bring those two ends together in a modified two-layer closure that we do here at the Reversal Clinic. This is a simple vasovasostomy or vas repair. Interesting, the vasectomy is, ectomy means the cut. It's a cut in the vas. It's dividing the vas. The vasovasostomy is, ostomy is opening. So there's a reopening of the vas that's performed at the vasectomy site. Now, not infrequently, a patient will say, well, the doctor told me that this can't be reversed. It's not reversible. And my answer to that depends upon what category the patients are in. We tell patients before surgery that your odds of success are based upon the interval from vasectomy, the number of years from vasectomy. The most common interval for our practice over the past 12 years has been in the 3 to 6 year category. And in that category, we have a 91% return of sperm rate after surgery. So I tell them, the doctor that says it's not reversible, there's a 9% chance he's right, there's a 91% chance he's wrong after the procedure. The doctor needs to give you the worst case scenario. If he gave you the most optimistic possibility after reversal, and you were not able to reverse, you would not be happy with him. So he's going to paint the bleakest picture, which in fact is only a minority of patients. The vast majority of patients we've seen have had excellent outcomes after the microsurgical repair here down in the clinic under local anesthetic with the use of surgical microscope. Well, thanks again for watching. This is Dr. David Wilson with thereversalclinic.com. I'll see you on the next video.